Tendonitis, causes, symptoms and treatments. Tendonitis, an inflammation of the tendons, commonly affects individuals engaged in repetitive motions or activities, such as athletes, manual laborers, and office workers. The condition typically arises due to overuse or strain on the tendons, leading to pain and restricted movement. Causes of tendonitis include repetitive motions, improper posture, sudden increase in activity intensity, and inadequate warm-up or stretching routines. Additionally, aging, poor ergonomics, and underlying conditions like arthritis can exacerbate the risk. Symptoms of tendonitis vary depending on the affected area but often include localized pain, tenderness, swelling, and stiffness. Patients may experience discomfort worsened by movement or pressure on the affected tendon. In severe cases, individuals may notice decreased strength and range of motion in the affected joint. Treatment for tendonitis focuses on reducing inflammation, relieving pain, and promoting healing. Initial measures often include rest, ice therapy, and elevation to alleviate symptoms and prevent further strain. Nonsteroidal anti-inflammatory drugs, NSAIDs, may be prescribed to manage pain and inflammation. Physical therapy plays a crucial role in rehabilitating tendonitis by strengthening surrounding muscles, improving flexibility, and correcting posture or biomechanical imbalances. Therapeutic exercises and modalities like ultrasound or electrical stimulation aid in promoting tissue repair and reducing pain. In some cases, splints or braces may be recommended to immobilize the affected joint and provide support during activities. Corticosteroid injections may offer short-term relief by reducing inflammation, although repeated use can weaken tendons and lead to complications. For chronic or severe cases of tendonitis resistant to conservative treatments, surgical intervention may be necessary to repair damaged tendons or remove inflamed tissue. However, surgery is typically considered a last resort when all other options have been exhausted. Preventing tendonitis involves practicing proper ergonomics, maintaining a balanced fitness routine, and gradually increasing activity intensity to avoid overloading tendons. Incorporating regular stretching and strengthening exercises can improve tendon resilience and reduce the risk of injury. Early recognition and intervention are crucial in managing tendonitis effectively, as untreated cases can lead to chronic pain and disability. Seeking prompt medical attention and adhering to treatment recommendations can facilitate a faster recovery and minimize the impact of tendonitis on daily activities and quality of life.